In this video, we're going to focus on the parathyroid glands. Remember, these are 4 glands that are embedded in the posterior side of the thyroid gland. And they're separate glands than the thyroid gland, have a separate function than the thyroid gland. They just happen to be embedded in the thyroid gland. And if you look at a parathyroid gland, you're going to see these cells in here called chief cells. And chief cells produce parathyroid hormone. Really important to make sure you know that when we talk about blood calcium regulation, it primarily involves 2 hormones. And you want to make sure you can talk about these 2 hormones and how they regulate blood calcium levels. These are calcitonin and parathyroid hormone. In a previous video, we went over calcitonin and how calcitonin lowers your blood calcium levels when they get too high. Well, cells within the thyroid gland, called your C cells, or parafollicular cells, produce calcitonin. And calcitonin is going to decrease blood calcium levels when they get too high by stimulating calcium to be taken up by bones. It also reduces calcium uptake in the kidneys so that you release more calcium into the urine, and that's going to decrease your calcium levels back to the normal level. Parathyroid hormones do the opposite. Whenever those calcium levels get too low, parathyroid glands are going to release parathyroid hormone, and that's going to stimulate your kidneys to reuptake more calcium from the filtrate so you don't lose more calcium in your urine. It's going to stimulate the breakdown of bone to release calcium from bone in order to get it into your blood, and also increases the calcium uptake in the intestines, thereby increasing your calcium levels back to the normal level, homeostasis, and prevent your calcium levels from getting too low. So these 2 hormones really important in calcium regulation. So we look at the parathyroid gland. As I said before, these are 4 small glands that are embedded in the posterior wall of the thyroid gland. Chief cells, you want to star that, secrete parathyroid hormone. Now this is also called parathormone, and this is going to increase blood calcium levels by 3 mechanisms. 1, it's going to stimulate osteoclast activity to break down bone and release calcium. Remember, you have these 2 basic types of cells that are going to be involved in adding bone, which are your osteoblasts, and those cells that break down bone, osteoclasts. Remember, bone is dynamic. It's constantly being broken down and rebuilt over your lifetime. The second way the parathyroid hormones work is they increase the rate of calcium absorption in the intestines, thereby absorbing more calcium to raise blood calcium levels. And the third way increases the rate of calcium reabsorption by the kidneys, so you lose less calcium in the urine, you reabsorb it back into the bloodstream. And along with calcitonin, provides a dual mechanism for regulating blood calcium levels. However, parathyroid hormone is the single most important factor in the regulation of serum calcium concentrations, more so than calcitonin. When you look at parathyroid gland disorders, you want to make sure you know what happens with hypoparathyroidism and hyperparathyroidism. With hypoparathyroidism, low levels of parathyroid hormone is going to cause hypocalcemia, or low serum calcium levels. Because remember, parathyroid hormone is what is going to cause an increase in calcium when it gets too low. So if you don't have enough parathyroid hormone, then that's going to result in hypocalcemia. And this can be caused by removal of the parathyroid glands during surgery, especially if you're removing portions of the thyroid gland, damage due to radiation in the neck region, or from an autoimmune disease. Hypocalcemia affects nerve and muscle functions in different ways. 1, you want to make sure you know that hypocalcemia is going to cause an increase in excitability of nerves that are going to lead to spontaneous contractions, such as twitching and muscle spasms. It can also cause skeletal muscles. It can also result in carpal pedal spasms, as well as paresthesia and convulsions. And you want to make sure you star these 2, Chevestek's sign and Trousseau's sign. Hypocalcemia can result in these signs, one of which is Chevestek's sign, and this involves contraction of the ipsilateral facial muscle. Ipsilateral just means on the same side, so when you tap on the facial nerve, this can cause the facial muscle to contract. If you tap on the facial nerve just anterior to the ear, it can cause the facial muscle to contract. That's on the same side of that facial nerve that you're tapping on, hence the name ipsilateral. Well, Trousseau sign, this is induced carpal pedal spasms. You can see here the hand and wrist turning inward, and this is due to an inflation of a blood pressure cuff about 20 millimeters above systolic pressure for around 3 minutes. But it doesn't have to necessarily be for 3 minutes. I've seen this happen when just after a minute or so, depending on how low the blood calcium levels are. Chevestek's sign, not always seen, but Trousseau's sign is seen more often. Here's a short video from Hippo Education on Chevestek's sign and Trousseau's sign.
Hi there, welcome to Hippo Shorts. In this segment, we're going to talk about Chevestek's sign and Trousseau's sign. So these are the classic physical exam findings we see in patients with hypocalcemia. So let's take a look at Chevestek's sign. What we see here is twitching of the facial muscles in response to tapping over the facial nerve area. Unfortunately, this test is neither sensitive nor specific. It's absent in about 30% of patients with hypocalcemia and present in 10% of patients with normal levels of calcium. Let's take a look, though, at this next test. This is Trousseau's sign. What we see here is the development of carpal pedal spasm that results from ischemia. One way we can induce that ischemia is application of a blood pressure cuff. So that gets inflated over the arm, and then we see this gradual flexion of the fingers and thumb, and then we also see flexion at the wrist, and then some degree of pronation. So this test is actually more sensitive and specific. It's present in 94% of the patients with hypocalcemia and only occurs in about 1% of patients with normal calcium. That wraps it up for this section of Hippo Shorts.
Hypocalcemia can result in weak cardiac muscle contraction because the cardiac muscles rely on extracellular calcium as part of their mechanism for contraction. Now remember we talked about cardiac muscle. We have what was called calcium-induced calcium release. And when that action potential comes down the sarcolemma of a skeletal muscle cell and it comes down the T-tubules, it's stimulating the open and voltage-gated calcium channels. And calcium is going to come through and it's going to stimulate the release of calcium from the sarcoplasmic reticulum. Well, together with the calcium from the sarcoplasmic reticulum, this calcium from the extracellular fluid participates in muscle contraction. So you get about 20% of your calcium for muscle contraction from the outside or extracellular fluid and then 80% from the sarcoplasmic reticulum. Well, if you have low blood levels of calcium, then that's going to be less calcium coming in for muscle contraction. This can result in a weaker cardiac muscle contraction. Skeletal muscle doesn't have calcium-induced calcium release. In skeletal muscle, you have the change in shape of the dihydropyridine receptor, DHP receptor, that pulls open the calcium release channel. You can also have heart arrhythmias, such as a prolonged QT interval, and in severe cases can lead to heart failure. Well, a QT interval, if you look at the different waveforms of a basic EKG, you have your P wave, your QRS, and your T wave. The QT interval starts from the beginning of the QRS all the way to the end of the T wave. And basically what the QT interval shows is the depolarization and then repolarization of the ventricles. So if you have low calcium levels, this can result in a prolonged QT interval. We'll talk more about this when we get to the heart. For right now, you just need to know that hypocalcemia can certainly cause heart arrhythmias, one of which is a prolonged QT interval. With hyperparathyroidism, this is where you have increased amounts above normal of parathyroid hormone, which is going to result in increased amounts of calcium. Most often, it's caused by a tumor of the glandular tissue, the parathyroid gland, an adenoma. Well, hyperparathyroidism is going to lead to hypercalcemia, or high serum calcium levels. Well, hypercalcemia can lead to a shortened QT interval and hypertension. And this is going to be primarily due to vasoconstriction. Has a minor increase in cardiac contractile force, but not really substantial. Main thing is that you can have hypertension because remember, those smooth muscle cells that are surrounding the arterioles, those are voltage-gated calcium channels that open when an action potential goes down those smooth muscle cells, so calcium comes in to cause contraction. And increased calcium levels can cause vasoconstriction, hence leading to high blood pressure. But the most serious effect, and you want to star this, the most serious effect is that it causes calcium to leave bones because that hyperparathyroidism can cause osteoclasts to break down the bones, and it's going to remove calcium from bones in order to put calcium out into the blood. This can lead to osteoporosis and increased fractures. It can also lead to the development of kidney stones because of all this calcium into the blood. So parathyroid hormones have a very important role in calcium regulation. Let's test your knowledge on the parathyroid gland. Go ahead and pause your video and select the term that makes a sentence correct. Here are the answers. Parathyroid gland disorders, part 1. Go ahead and pause your video and select the term that makes the sentence correct. Here are the answers. Part 2. Pause your video and select the term that makes the sentence correct. Here are the answers. Part 3. Go ahead and pause your video and select the term that makes the sentence correct. Here are the answers. This concludes the video, and let me know if you have any questions on the parathyroid gland.